And the monkeypox outbreak continues worldwide and right here in the United States. According to the CDC, right now there are close to 3,500 cases in America. Just 5 states in the nation haven't reported a case yet.
Here in the DMV, the Virginia Department of Health reports 72 cases. The CDC reports 87 cases in Maryland, but that number could be higher because CDC data has been slow to update. And the district has the most cases at 172, according to the DC Department of Health. That includes 1 child who visited DC and tested positive.
So what's the district doing about those high case numbers? The city has been rolling out vaccines for eligible residents, but officials have now changed plans as demand grows.
Jess Arnold joins us live outside of the DC Department of Health this morning with the latest updates. Jess, good morning. What's changing?
2 big things I want to point out. One is that DC Health said they're moving to a 1-dose vaccine plan instead of a 2-dose because of a spike in cases and limited availability. And also they said by the end of the week they're going to be adding a vac site in either DC's Ward 7 or Ward 8. So we're looking out for more information to come later this week. Now, all of this was discussed in a town hall that DC Health hosted with DC's LGBTQ newspaper, Washington Blade, last night. They were hoping to clear up any misinformation and answer questions.
We need to create forums where we can have honest dialogue about what this means to our community.
Viruses don't discriminate. Humans discriminate.
And so far, monkeypox is impacting the LGBTQ community disproportionately, with about 90% of cases being reported among this group, according to DC Health. But we want to emphasize that experts there reiterated that anyone can catch this disease. DC Health epidemiologists said that the virus spreads through skin-to-skin contact and that there have been no airborne cases in the U.S. That's because they say, unlike COVID, monkeypox molecules are relatively big, so they don't stay in the air. Now, DC Health experts say symptoms usually include some of the ones you're seeing on your screen, like fever, headache, swollen lymph nodes, fatigue, and the telltale rash that can look like pimples or blisters. Now, they say healthcare providers can test for the illness, but patients must have that rash or a lesion for the test to work. Now, DC Health said so far they've only received about 12,000 to 14,000 vaccine doses. They're hoping to receive another large batch by the end of August into early September. And at that point, if their supply can finally rise to meet the demand, they're hoping to then expand eligibility to more people. So we'll just have to keep you posted on where that stands. Ladies.